Yeah. Okay. I think it's quite late, and I'm thankful to the chairpersons as well as Rishi Prasher also for the giving this opportunity to talk on PRP, which I have been involved for quite a number of years now. And as the topic is not PRP in here, rather I was told to talk about PRP in dermatology. So in the first time I only spoke about how I have been doing PRP in here, but now obviously PRP has got other indications which I'm going to talk in few minutes. And it will be more for the newcomers who want to start, that what PRP is, as it indicates that PRP is basically the increased concentration of autologous platelets suspended in a small amount of plasma after centrifugations. And as far as the normal blood is concerned, it has got 93% RBC, 1% WBC and 6% platelets. But when we are getting PRP or platelet-rich plasma, it has got the reverse, 94% platelets, while less than 5-6% is the other cells available. I am just going to really show some of the slides for those who wants to prepare PRP themselves. As we know, PRP is available commercially in the market also, which many people use, but I am preparing myself in my lab. And as you can see, that normally you have to have a blood sample to be taken. It is a anticoagulant tubes, and we obviously take this vacutainer to take the blood. Important thing is not to shake too much, and you must keep them on a rack for about 10 minutes for the whole blood to settle down before you put it into the centrifugation machine. And we have got a refrigerated one, and we keep at a temperature of 16 degrees throughout the procedure. And as you can see here, that there is once we centrifuge these tubes, then you will see a rim of the platelets. There are two methods basically. One is called single spin method, another is called double spin method. If you do a single spin method, that means that if you centrifuge your blood sample on 3000 RPM for about 15 minutes or so, a ring is formed on the top on the basis that there is all the blood cells have got a different density and the weight. So the red blood cells are the heaviest, so they will come right on the bottom, and then come the WBC, and platelets are the lighter, and they will come on the top. So once we prepared it, we obviously have to take these platelets out. On the top of the platelets is purely what we call PPP, means platelets, poor platelets plasma. So they have got hardly any platelets. All the platelets are in a ring form. So the most important thing is how to take them out. So if you can see here, you have to need expertise, that you have to shake those or remove that ring and make sure you don't really disturb the RBC which are underlying it. And that is the main point here, that you achieve the results. If you shake it strongly, then the RBC will mix with it, you won't achieve the results. So it is very important that when you are touching this platelet ring which has been formed, that our technician feel more comfortable. If you are not comfortable with this procedure, then the other procedure is called double spin method. And in the double spin method, as the name indicates, the first spin is soft spin. You spin the sample in about 1000 RPM for about 10 minutes, and all the RBC will settle down, and the top you will remove it and spin again on about 2800 RPM for 10 minutes, so that the poor plasma will be on the top and the platelets will settle down. So this is much easier also. Then in 5 ml of a tube, we normally get about 1.25 ml. So this is the way. It doesn't matter which method you do, but that is how we prepare. In my lab, we prefer this method because my technician is very much comfortable. He's been doing for the last 6 years. And also it is very important that time to time you must take quality control. That means we take a sample of patient's blood to start with, as you can see here, and they are all RBC, and the next slide on your left is completely platelets. So there is hardly any WBC or RBC mixed. So it is important that when you are preparing for yourself, it is very easier for you to have a quality control. You can test any time you want to do it, and you want to make sure your technician does the job properly. And that is very crucial point to achieve the standardized results that you want to achieve. Another thing is that you want to activate the cells. So this is calcium we add in this plasma once it is formed to activate, and it is very important that once this plasma is activated, then it should be injected within 10 minutes or maximum 30 minutes. So it is important that you activate the cells just before you are ready to inject. And in our setup, we do under local anesthesia to reduce the pain for the patients. And we use the scalp roller. I do twice scalp roller. Once is in the beginning, but I call it as a soft scalp roller, and then we inject this plasma at a gap of 1 centimeter gap, and at one place we inject 0.03 ml. And how do we know? Because in 1 ml, we take 0.03, that means about 35 square centimeter you can inject a different area of the scalp. I hope you get my point. So in other words, when we are taking, we have got our, this PRP available and we want to inject, it should be injected at a gap of 1 centimeter. That's number one. At one area, when we inject 0.03 ml or milliliter, then there is a slightly raised bumpy area and which you can easily see it, and then go on injecting. So in 1 ml, roughly you get about 35 square centimeter cover. And you can always measure what sort of scalp you are dealing with, how much this PRP you need, and that is how you can extract the blood to start with. And once we have done it, then obviously you need to inject. And once we have injected, that is the second time I go with a firm roller. So that means I do twice this roller. One is soft roller to start with. We inject the PRP, and then I do the little strong roller. Idea is to degranulate the granules, cytoplasmic granules, so that they release all the factors that what we need. Then obviously we massage with the antibiotic on the scalp to prevent any secondary infection and send the patient home. There are a couple of instructions we give to the patients. Number one is that on particular day, obviously patients are not supposed to use any comb or wash it. We prefer not to wash on that evening, rather do it next day. And this helps us to prevent any secondary infection by not using the combing on that evening, as well as not going out and getting it contaminated with the pollutions which you have got outside. Secondly, most of the time in the men, I say don't drink on that night to prevent any bleeding or anything happening. Number third, for a couple of days, I tell my patients not to do severe exercising, because one of my patients was a very gymming person. She had a head down and all sorts of things, and she developed edema. That was the only patient, and you learn from the patient. So I always tell my patients not to do severe exercise or any strenuous exercise for a couple of days. So with these instructions, we send the patients home, and we obviously get the results. In my own experience, I get about 85% of our patients show some significant hair fall in about 4 to 6 weeks. In about 50% of the patients, they get their thickness of the hair so that they start feeling there is some volume. And in about 30% of the patients start showing us new growth because they have got a dormant stem cell stimulating effect as well. So this is how we explain to the patients what they should expect and how we monitor it. We do some kind of screening, the computerized screening of the hair, and then we show the patients in 2 months and 4 months interval. So this is about the hair. So what is the effect of the platelets?
Dr. Joshi, you have to wind up.
Am I fast? Okay.
Yeah.
Just give me another 5 minutes, please.
No,
so
sir. No, sir. No 5 minutes.
Okay. Every platelet is a biochemical store, a house of regulatory, signaling, and growth factor molecules that participate in recovery and healing of the tissues. So growth factors, you know all those growth factors. I don't have to name. But the most important for the hair is this endothelial growth factors, and all others are very important for healing. Mechanism of healing is attracting undifferentiated stem cells, suppressing cytokines, attracting macrophages, and promoting the new capillary growth.
Sir, you can skip the theory part.
Okay, so basically indications of the PRP is very important, and the most important I have been using is in the chronic ulcers. All sorts of ulcers can be used. Now the only tip I can give those who wants to use it, that if you use this calcium and leave it for a few minutes, the whole PRP become quite gel type, and that is what you need. You can also add some hyaluronic acid in it and then do twice a week dressings, and ulcers generally show you a good response. Here I have already told you the facial rejuvenation I have been doing now. PRP is wonderful, as you have already heard, that it is good for fine wrinkling, photo-damaged skin, as well as it does help in the pigmentation as well, along with other modalities. Scar, it is also one of the mode that you can do subcision. At the same time, you can use either PRP alone, or you can add some fatty tissue with it, and that gives you better results. And in some patients, you can use fractional CO2 laser, as you have already heard in earlier. I have this case I want to show you. This is one indication I have used in 3 patients in a hidradenitis suppurativa. That obviously patients was recurring, was not responding to most of the conventional treatment. I have used it once, then 1 month and 3-month interval, and the patient is absolutely fine for the last 1 year. So I am very happy. I am doing this sort of study in few more patients who can afford and who can really come for the treatment. Safety is pretty safe because it is an autologous product, so generally there is no problem. You have to be careful about secondary infection, or nerve trauma is another potential risk. I must mention here that in some patients telogen effluvium can be a problem, especially on those who are anxious and stressed because of many reasons, so be careful when you select your patients. Contraindications, we all know, thrombocytopenia and all sorts of things, as you can read, can be another factor. Pitfalls, the problem with this PRP therapy is that it is still not FDA approved, although it is done wide in all continents. Americans are the first one who started, but they have to seek the permission, and there is no standardization about the dosimetry technique, preparation and all sorts of things. But on the other hand, it is an exciting thing, and I think most of the dermatologists, quite a few if not most, and the plastic surgeons are all involved in PRP, whether for the hair or rejuvenation or for the scars, and I think we have to have better training, and we have to have a better details of its scientific evidence, the papers, so that we know the double-blind study. No one is available to know whether alone PRP is effective or it is only effective when it is adjuvant with other modalities available.
Thank
you very much.
Thank you, Dr. Joshi. Before you leave, can I ask you a small question? What do you think is the mechanism it works in hidradenitis suppurativa?
Well, we know that obviously this is a neovascularization. As I said, one of the slides, I didn't go through it, that this is a wonderful stuff in the healing process. Like that is how it was used in the maxillofacial. It has been used for the orthopedics, so that it has got a connective tissue regenerative this feature. So when you are using in a hidradenitis, when there is a lot of inflammation, it has got a wonderful stuff as an anti-inflammatory and to improve the collagen tissue. So in this particular patient, he had a marked scarring, he has got a sinuses, and he had all sorts of features as we see in hydenitis. But end of the day, now it is all smooth. He didn't have it only on the axilla. His lower abdomen was also involved. So I think this is probably, it's an adjuvant. I'm not saying this is the only treatment, but I think in most of the indications, it is an adjuvant to other modality that which we are using.
Thank you very much.
Thank you.
Okay, the next speaker in this session is Dr. Hema Pant, and she'll be talking about non-invasive facial tightening.
Good evening, everybody. Looking at the paucity of time, I think I'll quickly summarize the things. Basically, facial skin tightening, what are the expectations? So when we are looking at skin aging, the causes, so genetic factors, photoaging, free radical damages, chronic illness, malnutrition, rapid weight loss, and permanent stress. These are the enumerated causes. And when we look at types of aging, there is a chronological aging and photoaging. I would like to just highlight the difference between the two. Technically, if you look at, fibroblasts are active in photodamaged skin, whereas chronologically aged skin, the fibroblasts are inactive. So this is one of the very important parameter. Depending on that, we can stimulate. So all the treating a photo-aged skin is much more easier, and doing a fibroblastic stimulation is a good idea. Now, if you look at the Glogau's photo-aging classification, so there are four stages: no wrinkles, wrinkles in motion, wrinkles at rest, and only wrinkles. So classically, when we see no wrinkles in the early age group 20 to 30, early photo-aging, mild pigmentary changes, there is no keratosis and no wrinkles. Then in the stage 2, what we see is 30 to 40, early to moderate photo-aging, senile lentigens, and there is no palpable but no visible keratosis. And at the wrinkles at rest, third stage, there is an advanced photo-aging, obvious dyschromias and telangiectasias, and the fourth stage, normally patients are 60 plus, and then we start seeing severe photo-aging. Now, if you look at factors causing aging in the skin, I think this is one of the most important slides when we are considering things, especially in terms of treatment. One is gravitational force. Second is depletion of subcutaneous fat accumulation, and resorption of bones and cartilages. So if you look at all our managements and treatment plans depend on this particular thing. If we are looking at gravitational forces, so there is a dehiscence, so there is a slight laxity. Whereas when we look at depletion of subcutaneous fat pad, there are few fat pads, forehead and periorbital, buccal and nasal, these fat pads, there is a depletion. Whereas subcutaneous fat accumulation, especially in the submental, lateral malar area, is a known aging process. So when we are addressing, in fact, for these two fat pads, we need to do two different mechanisms. One, we have to inject, second thing, we have to slightly restore. Now, if you look at signs of aging, early signs, there is a dry skin, few dull and uneven skin tones, especially in the colored skin. Visibility of pores is the first thing, then there are age spots. So if you look at this is the way it goes, then fine lines, volume loss and sagging skin. There is something very characteristic about the volume loss. Everybody is not going to lose volume, and especially the deflation that happens is not going to be uniform also. So when we are using energy devices, we should be aware of this particular mechanism. So radiofrequency devices are basically used for skin tightening. Our experience is with the Thermat CPT. Now with the Comfort Pulse technology and the total tip available, this monopolar RF is working on the principle of deep volumetric dermal heating and achieved by using alternating current. So there is a contraction of collagen and subsequent neocollagenesis. So if you look at pre and post pictures, when we see, what we are seeing is, we haven't done anything, but the ligament tightening is something which is very visible, and that's the reason the radiofrequency, it works better. Other radiofrequency devices which are available are Polaris, Reforma, Alluma, Accent and Tripolar. They all are non-consumable ones, but they need repeated sessions, and we really can't document the changes in the first thing. Other interesting aspect is basically microneedling radiofrequency, which is really being not looked upon that much, but this fractionated delivery is one, it is controlling the depth. So I know which fat I can give. So 0.8 to 3.5 millimeter delivered by multiple needle electrodes. It can be utilized in patients with open pores, acne scars, as well as achieves a lifting of skin. The versions which are available as Scarlet, Secret, Evolastin, so these are multiple devices which are available for microneedling RF. Benefits are basically the depth of penetration can be controlled, which we are not having in our monopolar RFs. Volumetric tightening for sagging skin is observed, and there is a reduced open pores. It improves with superficial scars and acne scars. One particular thing that everybody can observe is smoothening of the skin. So if you look at microneedling RF, normally we say 2 to 3 sessions, especially for this particular case, and we can see even in the second treatment, there is an improvement and there is some volumetric tightening. Besides that, there are broadband infrared lights, there are multiple ones, but I would say these are adjuvant when I am looking at skin tightening. They are adjuvant to my radiofrequency or heating devices. Ultrasound techniques, now the micro-focused ultrasounds are available. Again, they are focusing on the subcutaneous tissue where the temperature briefly reaches greater than 60 degrees. So thermal coagulation point to a depth of up to 5 millimeters. So this depth is the maximum which is being achieved. I don't have much of experience for this, are only conservative about the facial fat loss, because fat compartments are quite sensitive. Then there is HIFU, which is the latest thing available. There are variable energy things, and only concern again is we are looking at permanent fat loss. So submental areas we strongly recommend. Rest of the areas we really don't have much of experience for particular this device. Now coming to thread lift. Whenever we are looking at facial tightening, we keep on getting people who are asking, can you lift the skin, as Dr. Kandhari was showing. So I think when we are looking at, these are the minimally invasive, fast and easy procedures. There's no scar, minimal downtime, and instant and long-lasting results. Threads basically are available in they're 100% biocompatible, and there are lot many varieties available, and especially the barbed ones and the cones one, these are the two threads variety which are going to give a very stronger lift. Insertion of threads basically is leading to inflammation, which is inducing fibroblasts. So it is producing collagen and elastin. So photo-damaged skin is a good option when we are looking at where there is a loss. Now coming to threads, basically if you look at pre-threads, whenever we are looking at the lower face, we can inject and basically we can squeeze the faces. So besides doing other injectables, threads are one of the cheaper options for skin tightening. See, basically when we are looking at, I just wanted to share, I'm almost concluding my presentation. I'm just going to share 3-4 photographs. These are the patients which are approaching us for skin tightening. But what we have done is basically if you look at the frame is intact, the face is slightly deflated. We can consider other modalities, but just by injecting. So coming back to fillers, that could be one of the mechanisms where we can lift out the face. We haven't done anything, just 2 ml of Voluma. Again, an interesting case. What we have done is the patient comes for skin tightening. Basically, the concern is meliomental. We have done just 2 ml of Voluma. So that injections, basically when we are looking at, we need to understand because the frame is intact. She is a good candidate for other therapies, but regarding cost and requirement for an instant result, these are the things which can be done. But still, I would like to say, this last thing, this particular case I would like to highlight, this is where we see the ligamental tightening. So these are the cases where we see there is a fat and there is a dehiscence. So these are the classical cases where doing a Thermage tightening works really well. The longevity of results are almost there for 1.5 to 2 years. And people who are averse to injections, this is a good modality. Cost is a concern. Thank you.
Thank you, Dr. Hema. It was really nice talk. And may I call upon Dr. Amit Luthra to speak on the post-procedure modalities.
Good afternoon, everybody. I'm like the last batsman where nobody cares whether he bats or not, but I'll try my best to probably give you a quick update on post-procedure modalities. Okay, moving on to the presentation. Okay, this is a poem I kind of wrote last night. This is according to the lecture. And this is what most of our patients, the cosmetic patients, come to us and have cribs about. This says, I once went to a dermatologist who gave me pain. I vowed never to return because he seemed so vain. He bruised me black and blue right when my anniversary was due. He did not tell me what to expect, babbled in some medical dialect. I wish doctors think of what happens next and do something about this post-procedure mess. So this is basically post-procedure modalities, and this is what I face day in and day out. A lot of times I end up bruising the patient, and I don't get those congratulatory WhatsApp that Anuj was showing. I get lots of abuses, choices of abuses at times. So these are the procedures I'll be covering: lasers, injectables, chemical peels, and cutaneous surgeries. In lasers, hair removal, fractional resurfacing devices,